Today is the National Health Service 75th birthday, and what a 75 years it's had. The NHS was first established in 1948 by former Health Secretary Nye Bevan. For the first time in history, people in Britain could access healthcare for free in what was one of the most transformative policies by any government in the 20th century. The idea of the NHS arose out of the ashes of the Second World War, when a Labour government swept to power on a radical platform for change. Prior to the NHS, people had to pay for a visit to the doctor or treatment, with voluntary organisations operating many of Britain's hospitals. This was the only route to treatment for the poor, while Bevan argued that healthcare should be available to all, regardless of wealth. By the time the first hospital opened, 95% of the population had registered for NHS treatment. Though the NHS introduced charges for dentistry and prescriptions in 1952, the health service remains free at the point of use, exactly as Bevan intended. It remained one of Britain's most beloved institutions for decades, but public satisfaction has been steadily decreasing since 2010, and in the past 3 years, the NHS has been struggling to recover from the effects of the COVID-19 pandemic, which put unbearable strain on staff and created a backlog of operations. There are now more than 1 million people in London awaiting hospital treatment, as well as longer waits for ambulances and treatment in A&E. Many doctors say the system is completely broken. As the NHS continues to play catch-up on the backlog, it is dealing with a series of unprecedented strikes. Last winter, nurses took to the picket line for the first time over paying conditions, before being joined by ambulance workers and junior doctors. Even consultants, the most senior doctors, will go on strike later this month. The British Medical Association, which represents doctors, argues that their pay has been significantly cut since 2008. As pay and working conditions continue to get worse, more doctors are leaving the NHS for countries like Australia or Canada, where they are promised better conditions, pay, and work-life balance. So while today might be a day of celebration, the health service Bevan created has never faced such a grave threat to its existence.